It all started the moment when I met him in his practice, Palm Springs. My career as a prosthetic urologist and my patient's happiness and me and my self-happiness as well. He taught me and he guided me and he raised me as a prosthetic urology and helped me up, and so far I am now here all because of him. I can say that. When I had the first training with him, and I had several trainings with him, of course, but after all those training ends, before I leave his practice, I asked him, Dr. Wilson, how can I, because he has no compensation nor from the company about my training, no from the company or nor from me, so he was doing it for free, I'll say. So I asked him, how can I repay this debt, Papa? No, back then I was calling him Dr. Wilson. So how can I repay this debt, Dr. Wilson? So he told me back that, Sean, make me proud of you. Oh, well, when you hear some words like that, your parents saying to you that, son, make me proud, how hard it can be is unimaginable. So that's maybe the reason why I still trying to do my best to make him proud of me, and I thank him for that kind of wisdom so that I can keep doing what I'm doing now. So he gave me everlasting flame into my heart, named as a huge debt toward him. He taught me how to live as a prosthetic urologist, not just my job. He taught me how to live the life itself. And as I had to start all by myself in my country, he guided me and raised me whenever I had a trouble. So he just did not tell me how to do the surgery, but how to live a life itself. And all thanks to his wisdom, I was able to survive all those difficult times, and now I'm here to say that I'm doing one of the most cases outside of the U.S. For the penile prosthesis surgery. He means a lot of things to me, not just a teacher, mentor. He's a father figure to me. That's why I call him as a papa. So he fathered me to be who I am now. Thank you so much, Papa, for raising me so far. And I still need your guidance, of course. Don't ditch me up until I'm fully grown up. And please be with us forever so that I can learn more from him and guide us forever and more. Well, as you now have, properly awarded, so I can say that long live the legend.
Well, I didn't really dedicate my life to treating erectile dysfunction. I started out as a general urologist, and but then I had a focus in erectile dysfunction. And back in the 70s, when I started, we didn't have any pills, we didn't have any shots, we didn't have vacuum devices, we didn't have any treatment at all. And then the penile prosthesis came out in 1973, and I did my first one in 74. So that's 44 years ago. Phew. And through the 70s, I might do one every 2 months, and then in the 80s it really caught fire, and then in the 90s we had the other therapies come along, and so I became an impotent specialist, and not only the penile prosthesis but all the other forms of therapy. Actually, at my age and my position, I don't really learn a great deal, and I come to these conferences because I'm an invited guest. And like this conference, I had 5 different talks that I had to give. So I prepare for those talks, and then I watch the other speakers, and occasionally, you know, I pick up a tip or a trick. And this happened to be a particularly good conference, and the program is excellent. I come really to teach more than I come to learn, but you always learn something. Well, I mean, when you've done more than anybody in the world, you have experience and lessons to be learned. And so it's nice that I can continue to come and pass on those lessons, because the younger guys, if they hear it, maybe they won't have the same mistakes that I made. Well, you know, actually, I just had one right before I came. And I put the device in this individual, and they were unable to urinate. So I put a catheter in for a couple of days, but you know, because you have cylinders in there and you have the catheter in the urethra, it's not a good thing. So I took the catheter out. He was still not able to empty his bladder. So I took a telescope with a TV camera on it and looked throughout the whole thing. Couldn't figure out why he was doing this. So now I'm faced with the dilemma of having to put the catheter back and worrying about whether it was going to mess up the device. But as old as I am, I remembered the old adage, it's not a sign of cowardice to ask for advice. So I picked up the phone and I called somebody here in the United States. It's like Dr. Park. It happened to be a female. She was maybe 40, and I'm 76, and said, well, what would you do? Yeah. And she gave me the solution, and I didn't even think of it. So that's probably the most, you know, old people remember things yesterday, but not a long time ago. Well, you know, interestingly, in this country, because advertising of prescription drugs is not illegal. This is probably the only country in the world that allows prescription drugs to be advertised in the media, on TV, in the magazines, and in the newspapers. And so, while ED was formerly, maybe 20 years ago, something that was taboo and nobody talked about, now it's on every TV channel. It's in every newspaper. So it really doesn't have the same stigma it used to. Oh, the greatest thing that I have, the thing I take the most pleasure from is the development of young surgeons like Dr. Park, who I consider my children. Well, he's a driven man. He has used his resources to achieve the best training that's possible. And he not only got the best training by spending almost a year over here shadowing big-time implanters, but even now he's spending a lot of money traveling the world to go to conferences to continue his education. So not only does he have excellent surgical skills, but because of this dedication to his field, he has developed an excellent educated mind. Oh, I think my advice would be to get up early and stay late. I mean, you know, you have to have a good work ethic, and you have to have thick skin. And it's a tiny, tiny little niche business, and you don't have very many colleagues, because only a very small percentage of the world's urologists do this tricky, risky surgery. So. Hard work and maintain your network of advisors. That's really necessary, like I said, when you have a very small network of people who are knowledgeable about this tiny little niche of surgery. So in order to get the most out of education and out of other people's advice, you have to maintain a good image in that network. And that's why I think so many successes on the panel today stress that you know, you have to roll with the blows and be accepting of others' mistakes, and but continue the network. And there's always the desire on the part of the physician when he's dealing with a patient that's not doing well, to say that, you know, the things that he is complaining about are all in his head. They're never in his head. There's always a physical reason, and while they may be obnoxious, you have to accept the fact that you did this to him, and he's your responsibility until he either gets better or gets worse and requires an additional surgery. Well, you know, all these years, Sean, I've been a teacher.
Yes.
And a teacher of a tiny, tiny little niche of surgery. And in order for a student to want to go through the rigors of education to get good at a tiny little niche of surgery, he's got to desire to be like his teacher. And if the teacher is successful, drives a nice car, lives in a nice house, wears a nice watch, then the student is more likely to desire to be like his teacher than he is if he doesn't have a coat and tie on and lives in a small house and is not successful.